accessory muscles of the ventilation. Suppose this is our rib cage. This is our rib cage. So here we will be having sternum and ribs. Here what are the muscles we are having? Diaphragm muscle, intercostal muscles, and skeletal muscles. These muscles these are the primary muscles of the ventilation. Accessory muscle means, so after this thorax, this is thorax. Now after this thorax we will be having abdomen. We'll be having abdomen. Here we'll be having upper limbs. Okay, here we'll be having two upper limbs. After this, here we'll be having lower limbs. Right. So the muscles which are connected to the rib cage from the abdomen, upper limb, head and neck. So from head and neck, some muscles will be connected to the rib cage. From upper limb, some muscles will be connected to the rib cage. From abdomen, some muscles will be connected to the rib cage. The muscles which are connected to the rib cage from the other portions. So those muscles are capable. Those muscles are capable of helpful in the ventilation. So when these muscles are going to helpful means, suppose if patient get injury, if patient get disease or maybe activity, or maybe he is doing some activity, so that time the other muscles are going to helpful for the ventilation. The muscles which are helping in ventilation other than primary muscles, those muscles are called as the accessory muscles of ventilation. So here in this accessory muscles of ventilation we'll be having so many muscles. And one more point, here we will see accessory. So suppose if this is our thorax, this is our thoracic spine, this is the sternum, here we are having the ribs, this is our lumbar spine, this is our cervical spine, here we will be having abdominal muscles, this is our pelvic, and here we will be having lower limb. Okay, now we'll see when the thorax is fixed, the accessory muscles are going to create a movement upward and downward movement of the rib cage, in the reverse manner, so that these accessory muscles are going to create the movement in the rib cage, in reverse manner. It will create the inspiration, and expiration indirectly. So that's why these muscles are called as the accessory muscles of the ventilation. Now we'll see, in these accessory muscles we'll be having so many muscles. First one, sternocleidomastoid, and second one we are having pectoralis major, we are having, and one more minor also will help in this accessory ventilation, and trapezius muscle will help in ventilation, and subclavius also will help in ventilation, and abdominal wall muscles. So what are abdominal wall muscles? Here we will be having external oblique aponeurosis, internal oblique aponeurosis, transverse abdominis, rectus abdominis, and posterior abdominal wall muscle, especially the muscle quadratus lumborum. So these muscles are the some important accessory muscles of the ventilation. We will see one point about one muscle. That's it. So now we will see sternocleidomastoid. Suppose this is our skull. Imagine this is our skull. Otherwise, we will try to see. Suppose this is our skull. Okay. Here we will be having cervical spine. This is our thoracic spine. So here this is our sternum. Imagine here we will be having clavicle. These are our ribs. So sterno means sternum, cleido means clavicle, mastoid means mastoid process on the temporal bone. So here sternal portion means the muscle is going to start from the manubrium. Here manubrium, so muscle will start from the manubrium, and cleido means from clavicle also muscle is going to start. So that is nothing but sterno and cleido. Mastoid, it is going to insert over the mastoid process over the temporal bone. So this is the sternocleidomastoid. So what is the usual function of this sternocleidomastoid? It is going to be helpful in the flexion of the cervical spine. Okay. Suppose if the cervical spine is fixed. Fixed means if the cervical spine is not moving, the action of the sternocleidomastoid can move the rib cage superiorly, because originally starting from here, insertion is here. So that here, if this muscle contact like this, so it can move the rib cage upward, so that here it is going to helpful in the inspiration. So that here it is going to create the pump handle movement in the rib cage. Sternocleidomastoid muscle can create the pump handle movement in the rib cage. Now we'll see the second important accessory muscle, pectoralis major muscle. Suppose this is our clavicle, So here imagine this manubrium, this is the body of the sternum, and here we will be having xiphoid process. Okay. So here we are having ribs, first rib, second rib, third rib, 4, 5, 6 and 7. Okay, total 7 ribs we are having here. It is just an imaginary diagram. You have to understand by like imagine. So here we will be having humerus. So the origin of the pectoralis major muscle, here we will be having, see here, clavicular portion of the pectoralis major, so that it is going to come from the clavicle, okay, one point, and one more pectoralis major muscle will come from the sternum, and up to 6 ribs, okay, sternum and 6 ribs. So this is complete about the pectoralis major muscle. It is going to insert into the humerus, as we all know, it is going to insert into the humerus. So this is the pectoralis major muscle. So here understand the point. Here we will be having two portions, clavicular portion and sternal portion. If we take only clavicular portion, the clavicular portion of the pectoralis major muscle can help in the both inspiration and expiration. Depends upon the position of the scapula and humerus. What it means? Suppose if the patient is in resting position, that means if he is not doing any movement, so that time the upper portion of this clavicular portion of the pectoralis major muscle can assist in both inspiration and expiration. If we take sternal portion, if we take entire pectoralis major muscle as one muscle, see, now it is going to insert into the humerus. Suppose if you see, now the person is in resting position, so you see the muscle insertion is below the, this is clavicle, the muscle insertion is below the clavicle. If the muscle insertion is below the clavicle, the pectoralis major muscle is going to helpful in the expiration. How expiration means? The action of this muscle in this insertion point, it is going to create the downward movement of the manubrium and ribs, so that it is going to create the expiration. Suppose if the person, if he rise his limb, rise means, see here he did like imagine like flexion or abduction, if he rise his limb, then insertion will come here, no, because major muscle insertion will come here. So if we see here, now the insertion point is above the clavicle line, so once the insertion is above the clavicle line, then this same muscle is going to helpful in the inspiration. It is going to create the upward movement of the manubrium and ribs. So this is how the pectoralis muscle will help as the accessory muscle for the ventilation. So now this is about the pectoralis minor muscle. If you see pectoralis minor muscle, here the pectoralis minor muscle will originate from the third, fourth, fifth ribs. Okay, it is going to originate from the third rib, fourth rib, and fifth rib. So this is the origin of this pectoralis minor muscle. So the action of this pectoralis minor muscle action, it is going to elevate the third, fourth, fifth ribs, so that it is going to helpful in the inspiration. Which inspiration? Deep inspiration. If we are doing deep inspiration, so that time the pectoralis minor muscle will help to elevate the like upward and lateral movement, upward and forward movement of the third, fourth, fifth ribs. So this is how pectoralis minor muscle will work as a accessory muscle. If we see first, second ribs, here we will be having first rib will get anterior scalene muscle and middle scalene muscle, okay, and second rib will get posterior scalene muscle. So first two ribs are connected to the scalene muscles, third, fourth, fifth are connected to these are scalene muscles, okay, these are connected to the pectoralis minor muscle. This is the scalene muscle, is the primary muscle of ventilation. Apart from that, here if you see first, second, third, fourth, fifth, sixth, these 6 ribs are covered by one large muscle. What is that muscle? We just discussed, that is pectoralis major muscle. And next muscle which is going to helpful in accessory function. Now we'll see one more important accessory muscle, that is trapezius muscle. Imagine now you are seeing a human body posteriorly. This is the skull, this is cervical spine, this is thoracic spine, this is lumbar spine, this is the scapula, and this is humerus. We are seeing it posteriorly. So from where the muscle will start? From the occipital bone. The muscle will start. So it will come like this. Okay, it is come like this, and it will insert. See, insertion is different. So this is T12 whatever. This is T12 whatever. So this is completely filled by the trapezius muscle. So here spinous process will come. No, so the trapezius muscle will attach to the all spinous process, and insertion over the spinous process. Insertion over the spine of the scapula. Spine of the scapula. So the upper portion of the trapezius is called as the upper trapezius. The middle portion of the trapezius is called as the middle trapezius, and lower portion is called as the lower trapezius. So okay, sure. Now here, what is the function mean? Here means the trapezius muscle is going to maintain or keep the head and shoulders in resting or neutral position when the sternocleidomastoid is acting. Sternocleidomastoid is acting. What it means, when the sternocleidomastoid muscle is acting for the ventilation, what is the function it can do? Sternocleidomastoid can do the movement of superior movement of the rib cage, when the sternocleidomastoid is working anteriorly. So that time this trapezius muscle is going to stabilize the head and shoulders in neutral position posteriorly, so that it's like a like a helping nature. When sternocleidomastoid is working anteriorly, trapezius muscle work posteriorly to stabilize the skull and shoulder joint to do the movement of the rib cage. Now these are the last muscles, abdominal wall muscles, accessory muscles. In that accessory, abdominal wall muscles, here will be having external oblique aponeurosis. Suppose this is our diaphragm, here we are having rib cage. Okay, this is our rib cage. Okay, this is our diaphragm muscle. So this is our abdomen, Imagine here will be having umbilicus. Okay, this is our inguinal ligament, So from here lower limb will start, So here external oblique aponeurosis and then internal oblique aponeurosis. So inside this external oblique aponeurosis will be having internal oblique aponeurosis, then transverse abdominis. Here will be having transverse abdominis and then rectus abdominis. Inside this, suppose if you see this transverse abdominis, it will be like this. It will be like a bag. Inside this transverse abdominis muscle, we can see this rectus abdominis muscle. It is a six-pack muscle, rectus abdominis muscle. So that here all these four muscles are going to helpful in the expiration. The major function of the abdominals with respect to the ventilation is to assist with the expiration, and that to forced expiration. These are going to helpful in the forced expiration, and at the same time, the abdominals have a significant role to play in inspiration. Also, these muscles are going to work. But most common primary function is its expiration. It will help in forced expiration. And one more point, during inspiration, the abdominals assist with the lateral chest wall. During inspiration, the abdominal muscles assist with the lateral chest wall muscle, so that the inspiration will happen properly. And at the same time, the muscular activity of the abdominals, increases during exercises. When we are doing exercise, the muscle activity will increases. Okay, why it will increase? Because here ventilation is needed. Here more ventilation is required. So that time here the muscle activity also will increase. Okay, these about the accessory muscles of the ventilation. And one more, quadratus lumborum is there. Muscle. This is also accessory muscle. Usually the action of this muscle is the lateral flexion of the vertebral column, and hip hiking. Even though this is doing these two movement functions, also this quadratus lumborum is going to helpful in the stabilization of the rib cage, because it attaches to the 12th rib. It is okay. This is about the accessory muscles of ventilation. Clear?